Today we're going to be talking about the adrenals, adrenal fatigue, and how the adrenals interact with the thyroid. My name is Dr. Greg Celaya. You know that feeling you get when you've been chased by a dog? If this were to happen to you, your brain would stimulate your adrenal glands to release adrenaline. It's a quick-acting hormone. And then stimulate your HPA axis, which is your hypothalamus, your pituitary, and adrenals, to keep the fight or flight mechanism going by releasing other hormones, mainly cortisol and DHEA. Your adrenals don't know the difference between the stresses you encounter. As a result, their output may be different in how much they release or for what period of time. Sometimes long chronic stresses like mourning a death can play a big toll on the health of your adrenal glands. They can get fatigued. So there are so many long-term factors that can affect your adrenal gland. So death of a loved one, marital stress, smoking, lack of sleep, poor eating habits, allergies, caffeine, white flour products, and there's so many more on this page, and there's so many more in general. Anything that causes you an outside stress can actually create issues for the adrenal glands. Well, I like to liken the adrenal glands to a glass, and the stresses you encounter is the water, the fluid you're putting inside, and you can see that when stresses accumulate, it can fill up your glass, so to speak. Here, things don't seem too bad, and your body seems to be handling it quite well. Now, this is a different story. You can see that quite a bit has been added, and the system seems to be maxed. Just one more thing will cause the glass to overflow, and now you have a problem, adrenal fatigue. So cortisol does have benefits, and it also has long-term, not so good benefits. You know, the benefits are there to actually help you get ready for that fight or flight mechanism when you're being chased by a dog or something just like it. So we actually take a look, and it helps maintain blood sugar levels in the carbon, fat, and protein metabolism, and it does so by gluconeogenesis in the liver. It also helps reduce protein uptake by the muscles. It helps you with immune responses and has anti-inflammatory properties, and we're going to see how that happens a little bit later on. It helps with blood pressure, it helps maintain blood pressure, so when you are in that flight mechanism, you're able to maintain blood flow. It helps maintain heart and blood vessel tone, pretty much the same thing. Central nervous system activation makes you more keen and aware. So we also take a look at the cortisol long-term issues, and they may not necessarily be so good. One of them is it dampens thyroid function. It helps create more blood sugar imbalances, which is not good. It decreases bone density. You end up with insomnia, increased blood pressure, decrease immune function, slow wound healing, increase abdominal fat. Usually end up with a little stomach pooch, and it's pretty indicative of adrenal issue. And cognitive disorders, so you're not necessarily as sharp as you once were. And insulin resistance, where your body's no longer listening to insulin, and that's one of the precursors for diabetes. So many patients come to me and just ask me, do I have hypothyroid or hypofunction of the adrenals? And it's not necessarily that easy from just symptoms alone. Let's take a look. So with both, you can have weight gain, tired, fatigue, no energy, losing hair, feeling cold, constipation on both. Sometimes with adrenals, you have a combination of constipation and diarrhea, but not necessarily. Lightheadedness, chronic pain, depression, and we got dry skin. So they're very, very similar in some of its symptoms. And we're going to take a look now and see what the differences are. So with hypothyroid symptoms, usually we have a thinning of the outside one-third of the eyebrow. Not necessarily irritable, just because you don't have the energy to do it. You don't have the energy to get mad. Cold hands or feet, high cholesterol and triglycerides if you have had lab testing for it. Puffy eyes. Usually you wake up in the morning and your eyes are really big and puffy, top, bottom, and sides. Hoarseness and slow heart rate. And you sleep more than normal. And some people report not even going to the bathroom as much. Whereas if you look at the adrenals, you get dizzy sometimes when you get up too fast. It's postural hypotension, easily irritable, more tired after meals. And if you're anything but satisfied after a meal, meaning you feel not hungry anymore, well, then there's a problem. Bloating and or gas, pale skin, brittle nails, chronic yeast infections, and we see this all the time. Trouble falling asleep even when you're tired, and a real heavy craving for salt and sugar. All right, this is a great slide to help us understand how the adrenal stress affects the thyroid. And we're looking at the thyroid on this side, and we're looking at the adrenals on this side, and we'll be talking about both of them. So what happens is stress affects both, but your hypothalamus tells the pituitary to release thyroid stimulating hormone. And its purpose is to tell the thyroid to speed up its production of thyroid hormone. Well, the thyroid hormone is inactive. T4 gets converted to T3 and then gets into the cell. On the other hand of the aspect, we have the hypothalamus telling the pituitary to tell the adrenal cortex to increase cortisol. And the reason we want to increase cortisol is we want to deal with the stress. So we've got to decrease circulation to the gut, we've got to increase circulation to the musculature, and so on. One of the problems that we see with this is when these levels get too high for too long, we end up with a problem where these different hormones block TSH, thyroid stimulating hormone, so the thyroid necessarily isn't working real well. And in addition to that, cortisol also inhibits the conversion of T4 to T3. So as a result, you can understand that you can't fix a thyroid problem until you fix an adrenal problem. So we're going to take a look at some lab testing to help us understand this a little bit better. Here's some lab testing I like to do, and we're looking at cortisol and DHEA, and they're salivary samples. So you're actually spitting into a little tube at several strategic times of the day, and we can actually see what's going on with your cortisol and DHEA levels. So the graph itself, you can see obviously here the green area is where you want your samples to lie. Yellow, of course, is getting a little bit of an issue, and red, of course, is where you don't want to be. So these times are real strategic because we want to see how your body's waking up. What kind of energies are you dealing with? So we come through, and this is a normal study, and it looks great. So here we look at an abnormal cortisol response test, and the diagnosis for this one's insomnia. You can see the green areas here, and these samples look pretty good until we get here where we're starting to get outside of the reference range. And right in this area here, you can see a big issue. So we're increasing our stress around from 3 to 5, but this person's not able to get to sleep. In addition to that, you can see DHEA problems. Next, we have abnormal, very high afternoon stress. So they wake up reasonably fine, but you can see what happens here from 11 to 1, or basically from when they first start in the morning. It's hard to say because we don't have samples in between here. And they come down into a normal. This far out of range can be a very big problem because of adrenal fatigue, which we're looking at next. So if this is not taken care of over time, you see what's going to happen. So the next one we're interested in here is adrenal fatigue, and you can see that our adrenal glands aren't even able to produce the cortisol to even be on the chart anymore. So we have some pretty serious issues here. In addition to this, we ended up with DHEA issues also. DHEA is an anabolic steroid hormone, and its main purpose is to build muscle, reduce fat accumulation. It helps balance body stresses response with cortisol. It can actually help reduce degenerative aging, helps influence the immune and energy systems, and can even affect insulin sensitivity. DHEA levels start to decline after the age of 30, which is usually when most adults start to experience weight gain, sluggishness, lower libido, and other symptoms caused from inflammatory problems. When we looked at lab testing before, we actually not only looked at cortisol, we talked briefly about DHEA. But you can see here as a normal cortisol level looks good, most of the time the DHEA looks good as well. When we have an adrenal fatigue issue here, you can actually see real low levels of cortisol, but on the other hand, the DHEA levels are increased. Here we have the DHEA pathway, and yeah, I know it looks kind of confusing and complicated, but let's see what we can do to simplify it. DHEA is a precursor hormone that actually feeds other hormones, like, for example, cortisol, the stress hormone we were talking about earlier before, and even cortisone, which is a good anti-inflammatory response of cortisol. So when cortisol gets high, because we're dealing with increase in stress, DHEA hormone needs to feed it. Well, that can account for DHEA getting low. On the other hand, let's say we have an adrenal fatigue where cortisol is almost non-existent, DHEA starts to build, but this is not always the case. We can actually see other hormones that are being fed by DHEA. We got testosterone and estrone, which is another form of estrogen. So if DHEA is inadequate, we're going to have hormonal problems also. If we see DHEA levels to be low, pregnenolone is another hormone that can actually be taken from this other pathway here to fill the DHEA needs. The problem is that pregnenolone fills other hormones, such as progesterone and all the rest down here as well. And we may end up with a lack of progesterone because of what we call pregnenolone steal, DHEA stealing pregnenolone to fulfill this responsibility. By the way, I want to show you up here that all this is fed by cholesterol. Cholesterol is a good thing, but we see many doctors telling you that cholesterol is not. Let's come up with a 3-part treatment program to actually fix the adrenals. First off, you have to make sure that you don't have a lack or excessive exercise. It's one of those things that you need to take it really easy for exercise. So, for example, if you're an adrenal patient and you're doing interval training, it's probably not your best means of exercise. Your best probably would be simple, easy walking, something very subtle that's not stressing out your system. You also want to reduce your exposure to blue light. Big issue nowadays because when we get home, we're on the computer or watching TV and those emit blue light. The problem with that is it actually causes problems with our circadian rhythm and creates bad sleep patterns. We also want to check for chronic infections. It's pretty common that people end up with small tooth infections that we never even know about or other type of infections. Counseling is a big part of just about any type of treatment regime. And I think counseling is always a great thing to get rid of all the little skeletons in your closet to help get rid of the stress and tension from the emotional standpoint. Yoga is great. I think yoga is a wonderful activity to really help you not only stretch, strengthen, but relax the mind and reduce worse stress. I don't know if that's possible for most, but it's something you have to work on. You also have to watch out for toxins. Toxins are a big part even in your work environment. You may have exposure to certain pesticides, certain hormones, certain analytes. It really depends upon where you work and what you're doing, but you need to make sure you're aware of what's happening. The second part of treatment is diet. And the first thing is we want to minimize all sugars and carbs or just about anything that can turn into those. Just remember, diet is a possible stressor to the adrenals as well. We've got to make sure. We also want to make sure that you eat breakfast. We have to make sure to keep blood sugar levels pretty consistent. So frequent small meals every 4 to 5 hours. High quality proteins and fats. You know, if you're dealing with a lot of foods that have hormones and pesticides, it creates some real big stresses in your body. And remember, it can overflow that glass very easily. Don't fast. We talked about before, we need to keep blood sugar levels consistent. We need to minimize any kind of stress. We want a good variety of veggies, everything from A to Z, because every different veggie has different properties and antioxidants, which we need for every chemical reaction in our body. Add salt to your food. Usually we're finding out with adrenal issues, there's a salt problem. And the way I like to look at salt is take your blood pressure. If you've got a high blood pressure, obviously you want to try and avoid salt. If your blood pressure is lower, you want to try and increase your salt. You want to make sure to look at all food allergies. And if you have them, you need to try and stay away from them. It's another stress. No caffeine or stimulants. Here again, the caffeine or stimulants help increase stress. You can actually start to eat bone broth. And if you've never heard of bone broth or haven't looked into it, do it. It's a great, great food and really helps with your microbiome. You want to avoid grains, anything like we talked about to minimize sugar or anything that can turn to sugar. Plenty of water. It's not uncommon that people drink 1 or 2 glasses of water a day. We need to increase the fluidity of the body so you can get rid of toxins. I like anywhere from 80 to 100 ounces a day. There's different programs, but if you drink too much water, you'll end up with a problem as well. And probiotics, real important. We want to make sure that not only do you have the microbiome that you want, particularly, but you want to make sure that you feed them well, and that's where all this diet comes in, is the different fibers that all these foods have are just so important to helping with your microbiome. Number 3, supplements. I think supplements are a very important part of dealing with adrenal fatigue, and the first one is phosphatidylserine. And what it does is it helps resensitize the hypothalamus pituitary to the cortisol negative feedback. You have vitamin B complex, vitamin C, and vitamin D. Vitamin D is really not even a vitamin anymore. It's considered a hormone. Adaptogenic herbs, and these help you cope with stress, and they're great, and there's many more, but these are the 3 that I found that really work well. Fish oil, and the fish oil is very, very important, and to have it good and clean and from the right source and third-party independently tested, fish oil is great. A good multi or specific supplements by lab results. If you just go with a good multi, it's really got to be good, but if you're just going to the store and getting the one a days, they're probably not going to cut it. Glutamine actually helps strengthen the gut. Makes a big difference for how your system starts to respond. And good protein sources. Want to make sure that your protein source is grass-fed, organic if you possibly can, because you don't want to have the stresses of those hormones and or pesticides in your system. Thanks for tuning in. I hope you've had some questions answered about your health. If you want to know more, go to my website, drcelaya.com, and schedule a free 15-minute consult, or just become a new patient. We'll look into your issues and with lab work, get to the bottom cause of your problems. If you want to see more videos like this about your health, please subscribe.